So, when you hear the word agoraphobia, what's the first thing that pops into your head? Probably a fear of crowds, right? Or maybe wide open spaces. Well, what if I told you that's only a tiny part of the story? Today, we're going to dive deep into what agoraphobia is really all about, and I think you'll be pretty surprised by what we find.
Here's how we're going to break it all down. First, we'll bust some of those common myths. Then, we'll get right into the core thought process, the real fear driving everything. After that, we'll look at how it's officially diagnosed, see how it's different from other anxieties, check out who it affects, and finally, really understand the huge impact it can have on someone's life. All right, let's jump right in and tackle that big misconception. If agoraphobia isn't just about crowds or open spaces, then what is it? Well, the actual clinical definition is way more specific, and getting this right is the first crucial step. Okay, check out that key phrase right there. Escape may be difficult or help unavailable. This is the absolute game changer. The fear isn't about the place itself. It's not about the bus or the parking lot. It's about the terrifying thought of having a panic attack in that place and feeling completely and utterly trapped. That's the real heart of it. So what's actually going through someone's head that turns a simple trip to the store into this terrifying ordeal? Let's dig a little deeper into the specific thought that fuels all this fear. And here we are. This is the absolute core of it. We're about to isolate that one powerful thought that really drives the entire experience of agoraphobia. This is it. This is the internal monologue. Escape might be difficult or help might not be available. It honestly doesn't matter if you're on a bridge, in a movie theater, or on a crowded train. That underlying fear is always the same. If I start to panic right now, there's no way out. I'm trapped. This one sentence just captures the entire essence of the condition. Okay, so how does a doctor or a therapist take that internal feeling, that very personal fear, and turn it into an official diagnosis? Well, they use a specific set of criteria from a manual called the DSM-5. Let's take a look at what they're looking for. The very first thing you need to know is the rule of two. This is super important. For a diagnosis of agoraphobia, the fear can't just be about one single thing, like, say, a fear of elevators. It has to consistently show up in at least two different kinds of situations. And these are the 5 main categories the DSM-5 spells out. As you can see, they cover a whole range of everyday scenarios. We're talking about things like public transportation, big open spaces like parking lots, and enclosed places like shops. It even includes just standing in a line or, for some, simply being outside of their home all by themselves. But the key is that core fear has to pop up in at least 2 of these different domains. And this isn't just about having a bad week or feeling anxious for a little while. To be diagnosed, the fear and the avoidance have to be persistent. We're talking 6 months or more. And here's the real kicker. It has to be severe enough that it's causing significant problems in someone's daily life, whether that's with their job, their school, or their relationships.
Now, you might be thinking, this sounds a little like some other things I've heard of. And you'd be right. Anxiety can show up in a lot of different ways. So it's really crucial to understand what makes agoraphobia distinct from other conditions that might look similar on the surface. So, for example, let's take a specific phobia, like being afraid of bridges. If someone is only afraid of bridges, or if their fear is that the bridge itself is going to collapse, that's a specific phobia. But if their fear is about having a panic attack on the bridge and feeling trapped, and they also have that exact same fear in movie theaters, then we're probably looking at agoraphobia. See the difference? And what about social anxiety? Someone with either condition might avoid a crowded party, for sure, but the why is worlds apart. With social anxiety, the fear is all about being judged, scrutinized, or embarrassed. With agoraphobia, the crowd isn't the problem. The fear is about having a panic attack in the middle of the crowd and not being able to get out. The motivation is completely different. And finally, let's think about major depression. Someone with depression might also stay home all the time, right? But you have to ask what's driving that behavior. Is it because of apathy, a total lack of energy, or just not finding joy in anything anymore? Or is it an active fear of what might happen if they go out? The first one points towards depression. The second is that classic hallmark of agoraphobia. All right, let's shift gears a little bit and look at the numbers. Who is most affected by agoraphobia, and what are some of the known risk factors? So, this is pretty striking. The data consistently shows that females are diagnosed with agoraphobia at about twice the rate of males. The exact reasons for this are still being explored, but it's a really significant pattern that we see over and over in the research. In any given year, it's estimated that about 1.7% of the population is dealing with agoraphobia. Now, I know that might not sound like a huge number, but think about it. That translates to millions and millions of people whose worlds have become incredibly small because of this condition. Now this is a fascinating piece of data. The heritability of agoraphobia is estimated to be around 61%. To put that into perspective, that is the strongest genetic link of any specific phobia. It tells us that while life experiences definitely matter, your genes play a major role here. Of course, it's not all about genetics. There are other pieces to the puzzle. On the temperament side of things, people with high anxiety sensitivity, which is basically the belief that the physical symptoms of anxiety are dangerous, are at a higher risk. And environmentally, things like stressful or negative events in childhood, or even having overprotective parents can also contribute. And that brings us to our final section, the long-term impact. If it's left untreated, what does the future actually look like for someone with agoraphobia? What's the course of the disorder? The tough reality is, this is not something that typically just gets better on its own. The course is almost always persistent and chronic. In fact, if it goes untreated, the rate of full remission, meaning it completely goes away, is incredibly low. We're talking only about 10%. And this statistic just shows how severe the consequences can be. More than a third of people with agoraphobia become completely homebound. Their world shrinks until it's just the four walls of their house. That internal fear we talked about, it literally builds a very real external prison. So we're left with this big question, aren't we? I mean, we all have fears. We all practice caution and avoid things from time to time. But where is that line? At what point does normal caution cross over into a disorder that starts to shrink a person's world until there's almost nothing left? It's a really important distinction to think about.
Okay, let's go.